Did you get fibroid removal surgery? You may be wondering if getting a myomectomy is truly worth it. Okay, it's my hair. You're gonna grab my hair. Yeah, we got a tight grip. I need my hair back. Should you get fibroid removal surgery? You may be wondering if getting a myomectomy is truly worth it. And I don't blame you because it can be a tough decision. Knowing that you need surgery done can feel frightening, scary, anxious, and emotional. And I don't blame you. I've been there. I had a myomectomy about 2 or 3 years ago. It was October of 2021, and I felt anxious, emotional, and just scared basically. And I found out I needed a myomectomy after going in to get more information on my fertility journey because I did not fall pregnant within the year after marriage. By the grace of God, I did fall pregnant 9 months. 9 months after I had my surgery. So I underwent the surgery, I had a positive outcome. So in this video, I'm going to discuss whether or not myomectomy is worth it. My name is Ann, by the way, from the Help Me Journey. Baby Honor will be joining us. It's almost her nap time, so she may fall asleep pretty soon. So in this video, I'm going to go over a few pros and cons of whether or not a myomectomy is worth it. And at the end, I'm going to give my honest, raw opinion and thoughts on whether or not it's truly worth it. So the first pro is that getting a myomectomy is very effective for trying to fall pregnant. So if you desire to fall pregnant and have a baby after getting the surgery done, I can definitely tell you that it truly helps because it's almost like having a clean slate. Your uterus has now been refreshed. Those fibroids have been surgically removed from your womb. It gives your uterus a clean slate basically. And the surgery itself preserves the womb. So surgically removing the fibroids has a better outcome. A myomectomy does not necessarily improve your fertility. So if you do get the surgery done and you're still having fertility issues like endometriosis, PCOS, you still need to get that, of course, checked out. My OBGYN/doctor reassured me a few times that it will definitely help get you pregnant after it's completed and you've healed in the right amount of time. And also with being up there in age, I know I look younger than I am, but being a lot older, it can definitely help give you that chance of falling pregnant and having your first baby. So if you desire to fall pregnant, I can definitely recommend having an open myomectomy, which is the traditional style, and I'll talk about that more later on in the video. Next pro of having a myomectomy, getting a myomectomy can help relieve the symptoms that are caused by fibroids. So it all depends on how big your fibroids are, where they're located inside the womb. It can help relieve pelvic pain, discomfort, excess bleeding, menstrual cycle issues, and things along those lines. Me personally, I didn't have any issues with my fibroids. I didn't have any symptoms with my fibroids. Most fibroids will not have any symptoms. I didn't even know I had fibroids until I went in regards to my fertility journey. It was all a surprise to me when I went in with the ultrasound to see why I did not fall pregnant. The next pro is that having a myomectomy is more guaranteed than those herbal treatment comments. But if you look at some comments or some websites online or on social media, you will see information about herbal treatments by foreign doctors, especially doctors out in the Middle East or in Asia. It seems pretty scammy. I don't know. I don't trust it. And I would not trust it. I would say getting surgery done is actually more guaranteed and a better option. It's always best to talk to your doctor. I wouldn't trust ordering something online that can just magically make your fibroids disappear or shrink or go away. There is no magic pill. Yeah, there is no magic pill for fibroids. I think surgery is the best option. The last pro I have are the different options you can choose for your surgery. There's open myomectomy, which is the traditional, normal process of removing the fibroids. They go 7 layers of skin to get to the uterus to remove the fibroids surgically. And there's one called, I believe, robotic surgery. And then you also have, if I can pronounce this, laparoscopic surgery. And I think that's when they use robotic tools or technology to help get the fibroids out. I highly recommend just doing the open myomectomy. That's just your surgeon will go in there with their hands and just go right in there and do what they need to do to get the fibroids out. It is similar to a C-section. It's just that there's no baby coming out. It's just the fibroid coming out. Okay, so moving on to the cons. So the first con is that it can be risky. Like any surgery, like anything we do in life, there's a risk to it. The recovery for myomectomy is 6 to 8 weeks. There's a lot of pain, soreness, and discomfort associated with having myomectomy, like any surgery. It'll be hard to go up and down the stairs, to drive and to walk for about a week or two. I remember it was hard to drive for about 2 weeks, and I could not use my stairs at all. You may risk having scar tissue. The chances of that may be low. I didn't have any scar tissue, like issues with scar tissue. My incision healed perfectly. It will get itchy because when your body is healing, it gets itchy. So you will feel that, just tingly, itchy towards the end of your healing. That could be annoying, but I just used vitamin E and lotion on my incision. I did not get any infection with my incision. That could be another risk, but the chances are low if you're cleaning it regularly, daily. One more con is that your doctor may recommend getting Lupron injection. And what Lupron is a injection that throws your body into menopausal state, and it lowers down your estrogen. So that's why it throws your body into a menopausal state as a woman. It helps with lowering down the estrogen to stop or pause your menstrual cycles to help your body heal. And then also decreases the chances of a fibroid growing back. I would say this injection is horrible. I had really bad hot flashes, terrible nausea. I was tired all the time. It was really, really bad. The hot flashes were so bad. I did not recommend it. It was horrible. And I didn't do much research about this injection. I just trusted the process, what my doctor was telling me, and I just went ahead and just got it done. Little did I know, the side effects to it are harsh. The last con I have, like I mentioned earlier, is about those doctors that promise you these herbal treatments and things like that. Like I said, it just seems kind of scammy. I wouldn't trust it. Your doctor would have way more information, and they can truly help you on this process. Diet change can help, yes, but if you already have fibroids, depending how big they are, where they're located, and how much pain they're giving you, and if you want to fall pregnant after getting them removed, then changing your diet may not help all the way. It can help once you got the surgery done and your body has been, like your uterus is now back at a clean slate. Yeah, diet change can help, but it may not really solve the issue at that time. Because if you have a huge fibroid that's in a really bad part of the womb and you're trying to fall pregnant, diet change may not help that. It's just probably best to get that surgically removed, so that way now your uterus is cleaned out and it's good to go and it's free from fibroids. Overall, is myomectomy worth it? I think yes, it is worth it. I went from having a fibroid removed the size of a golf ball. It was 3 centimeters, so maybe like this big or so. And after my surgeon or OBGYN did the surgery, he removed 7 more smaller fibroids. So I basically had 8 fibroids down there. I didn't even know. It is worth it. It truly did helping me fall pregnant. It's very effective with helping to preserve the uterus, to conceive and grow a baby. I do have more content in regards to my journey of fibroid removal surgery. It's in the playlist called Pregnancy and Fibroid Journey. Just go ahead and click through my channel, click on playlist, and you'll see more videos on this topic. Thanks for watching. Until next time. Say bye.